There you go.
You're going last.
I'm up first, I guess.
No worries.
You good?
I'm good, yeah. Yep.
I'm with
Oh, yes, that's right. Thank you so everybody. No, it's fine.
It never went as high as we thought it was going to go, but I think we were confused.
different strengths.
It is more incidental
Yeah, versus
with the COVID
primary.
principle.
Right. Everybody good? So I got me to Kara, then to Judy, to Pat, and then Dara. It's very rare that we have both a Kara and a Dara. Oh, Lord. What a day. Harvey, thanks for the weather. Is this you? Golly. It is an honor to be here and to be joined by the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. Another guy who does not need to be introduced, the Superintendent of the State Police, Colonel Pat Callahan, and his colleagues. Great to have you guys with us as well. And it is a treat to be with a dear friend, the president of Stockton University, this guy right here to my left, Dr. Harvey Kesselman. Harvey, as always. Atlantic County Board of Commissioners Chair, Maureen Kern. Where's Maureen? Maureen is behind a speaker over there. Maureen, great to be with you. Please give Denny and your colleagues my very best. Atlantic County Acting Public Health Division Director, Kara Jansen. Kara, great to have you with us. We'll hear from you in a minute. And Dr. Dara Cass, the Region 2 Director of the U.S. Department of Health and Human Services. Kara and Dara, thank you both for being here. I do have a policy announcement, which I'll make in a couple of minutes, but let's discuss first why we're here today. I am incredibly proud to join in opening this new regional surge testing facility, along with our federal partners at the Department of Health and Human Services and the CDC, our local partners in Atlantic County and Stockton University's Chris Gaup Residential Complex right here in Galloway Township. I also want to give a shout out to E-True North. This site is going to be open every day, I believe, at 7 a.m., 7 days a week for the next 3 weeks. The team here will have the supplies to administer 1,000 PCR tests per day with results in roughly 24 hours. And the doors will stay open either until 5 p.m. or until that daily number of 1,000 tests is hit, whichever comes first. Going back 4 weeks, this is an unfathomable number. Roughly 575,000 New Jerseyans have tested positive for COVID, and overwhelmingly with the Omicron variant. This 1 month has amounted to more than 1/4 of all of our cases since the start of the pandemic. Again, just 1 month out of, Judy, approximately now 23 months to have 1/4 of the cases. Put simply, an Omicron tsunami has washed across our state. While it appears that the Omicron tsunami is finally pulling back, we are in no position to say we're on dry ground. Testing has been a critical tool that has kept us above the rapidly rising case counts. Testing allows us to pinpoint trouble spots and anticipate where resources need to go. This morning, at least PCR cases, Judy, I show 8,467 new cases. I resist the urge to use the word only with this number, because even though it is thankfully lower than what we've been seeing earlier this month, it is still up there with the highest daily totals we were seeing at any of the peaks of the prior surges. By the way, spot positivity this morning still unacceptably high, 23.33%. And also, this number of total positives comes with an asterisk, as this is likely a dramatic undercount. We know many residents testing positive through at-home tests aren't reporting those cases, and those who haven't been able to get a test kit just go on without knowing. So we cannot look at a falling number and fall into complacency. Omicron inundated us once. We do not wish to see that happen again, and it can if we let our guards down. Sites like this behind me are how we get ahead of COVID to stay, so we can return our state and our communities to a much-needed sense of normal. And do not forget that this is a virus that can still land you in the hospital. As of last night, 5,204 New Jerseyans were being treated in our hospitals. Again, those numbers, thank God, are down from last week, but they still rank among the highest. Additionally, of those, 844 patients are in intensive care, and 519 of those require a ventilator, and those numbers have been hanging steady. And Judy, I don't want to put words in your mouth, but even though the total hospitalizations are down, the ICU count has stayed sort of static. Judy can address as to why she thinks that is true, and I cannot underscore enough that this virus remains potentially deadly as well. Today, with the heaviest of hearts, we are reporting another 145 confirmed losses of life due to COVID. When you get tested and you know your COVID status, you could take the necessary steps and precautions to not only protect yourself and your family, but to help further slow the spread throughout your community and workplace. Now, aside from here at this outstanding complex, again, Harvey, thank you, and Maureen for your great leadership and your colleagues. There are testing sites quite literally all across the state. And to find one nearest you, go to covid19.nj.gov and click on the link for testing. And while you're at it, make sure you are vaccinated if you are not yet, or go get your booster shot if you've been putting that off. And again, there are nearly 2,000 places across the state where you can get vaccinated or boosted. Again, go to that main website, covid19.nj.gov, and click the link for vaccine info to find where. We know the vaccines work, and we know the boosters work even more on top of that. Today, we are able, for the first time, to report on the breakthrough infections, which have become more common due to Omicron, and the numbers on booster shots are eye-opening. The rates of infection and hospitalization for those with boosters is more than 3 times lower than those who only have a primary vaccination, whose, by the way, chances for illness or hospitalization are already significantly lower than the unvaccinated minority of residents. And we will be posting through Judy's offices this data online for you going forward. Before I hand things over, I think first to Kara and then to Judy and Pat and Dara, I mentioned I do have an announcement to make, and it is this. I am signing an executive order today requiring all workers in healthcare settings and high-risk congregate living facilities, including our correctional facilities, to be up to date on their vaccinations. That means both primary course and booster, with no test-out option. It is important to remember that for those working in healthcare settings, the test-out option is already coming to an end due to the Biden administration's vaccine mandate, which the U.S. Supreme Court upheld last week. For those in our healthcare community who remain unvaccinated, you have until January 27th to get your first vaccine dose, and you must complete your primary vaccination series by February 28th. For those of you who work in high-risk congregate living facilities, we want to give you some more time. If you are unvaccinated, you have until February 28th to get your first dose and March 30th for your second. Again, healthcare workers, January 27th to get your first, February 28th to complete your series, high-risk congregate facilities February 28th to get your first, March 30th to finish your series. But the science tells us that it's no longer good enough to just receive your primary series, as being boosted is necessary to protect yourself and those around you. Therefore, everyone who works in these settings is now also required to get their booster. If you're currently eligible, but you haven't gotten it, please go get it. Currently eligible healthcare workers, again, have until February 28th, and high-risk congregate living facility employees have until March 30. For those of you who are going to become booster eligible beyond those cutoffs, you'll have 3 weeks from your booster eligibility date to get that added dose. Again, for workers in these facilities, testing out will no longer be an option. The only exemptions will be granted for disability or other medical reasons or for deeply held religious beliefs. Anyone found in noncompliance will be subject to their workplace's disciplinary process, up to and including termination of employment. We are no longer going to look past those who continue to put their colleagues, and perhaps, I think even more importantly, those who are their responsibility, in danger of COVID. That has to stop. But let me loop back to the here and now in this new testing site. All of us, Judy, Pat, myself, our teams, thank our federal, county, local, higher ed, and private sector partners for coming together with us to provide these tests. This site is another tool for us to not just get Omicron and COVID on the run, but to get ahead of this virus and to stay ahead of it. With that, please help me welcome the Acting Public Health Division Director in Atlantic County, Kara Jansen. Kara? Thank you.
Thank you, everyone, for being here today. I'd first like to thank our partner, Stockton University, for making this a very easy choice for a location for a testing site for the residents of Atlantic County. We've been able to get this site organized and up and running in a very short period of time. It's been a wonderful partnership. I'd also like to thank the Department of Health for providing the funding for this, Centers for Disease Control, and also FEMA for being here and helping support this site. As we all know, testing, there's a lot of reasons to be tested. It helps you know if you need to isolate or quarantine. It lets you know, lets us know what the transmission rate is for the variants of COVID-19 in the community. But vaccination, as the governor pointed out, is the way we're going to be able to overcome COVID-19. So the county offers free COVID vaccinations in Northfield, Tuesdays, Wednesdays, and Thursdays from 9 to 12, and in Hamilton on Tuesdays from 10 to 1. You can find all that information on our public Atlantic County government website. And if there's any other needs, we're here to help out. So thank you very much.
Thank you, Kara. Good job. Thank you, Kara, and thanks to your Atlantic County colleagues who have been extraordinary throughout this entire COVID pandemic. With that, please help me welcome the woman who needs no introduction in Atlantic County or any of the other 21 counties, the Commissioner of Health, Judy Persicelli.
Thank you, Governor. Governor Murphy, HHS Region 2 Director, new Director, Dr. Dara Cass. Want to introduce you? Dr. Harvey Kesselman, as always, the work that you've done is remarkable in helping us through this pandemic. Susan Davenport, Executive Vice President, Chief of Staff at Stockton, is always, there she is always willing to help us. Chairwoman Maureen Kern from the Board of Commissioners, is she right there? And Kara, thank you so much for all the work that you've done. And thank you to Atlantic County and Stockton for hosting this new testing site. We are most grateful to the CDC for their support in bringing this to New Jersey. As you know, this is the second site that we have in New Jersey. And testing has been and continues to be one of our strongest mitigation strategies in reducing the spread of COVID-19, along with masking, physical distancing, washing your hands frequently, staying home if you're sick, and of course, getting tested. With cases increasing and continued threats from Omicron and still Delta, this new site will help meet the testing demand And with federal support, we're meeting that demand not only here in Atlantic County, but up in East Orange as well. New Jersey has more than 1,000 testing sites. You can find those sites at covid19.nj.gov/testing. That includes free and public testing sites. The state has also, as many of you know, partnered with Vault Medical Services to offer home testing. You can visit learn.vaulthealth.com/nj to order your free test. If you feel ill or have been exposed to someone who tests positive for COVID-19, make sure you get tested. If you're traveling or have been to large, particularly indoor gatherings, get tested. If you are not yet vaccinated, do it today. Everyone ages 5 and older can get vaccinated at nearly 2,000 vaccination sites here in New Jersey. In just over 13 months, we have had 3 safe and effective vaccines to help fight COVID-19. 75% of those ages 5 and older who are eligible have already completed their primary series. If you have not yet received your booster, please find time to do so. Right now in New Jersey, 48% of the eligible individuals eligible for a booster have actually received a booster. So we have a long way to go in protecting all of us against COVID. Over 4.9 million individuals right now are eligible to get a booster. So let's do all that we can to make this year, 2022, a safe year, not only for yourselves, but your family, your friends, and most importantly, our children. Thank you.
Thank you, Judy, for everything. Dr. Susan Davenport, I didn't see you. Executive Vice President of Stockton University, honored to have you. My chairman, Mike Suleiman, is here. Mike, nice to see you. As Mike said, he lives 5 minutes away. There was no excuse not to be here, so great to have you. Please help me welcome another guy who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan.
Thank you, Governor. Good morning, everybody. I think back a few weeks ago when we opened up a site very similar to this up in East Orange, and our federal partners said, "What else do you need?" And we immediately said, "We need one down in South Jersey," and that led us to thinking about who are our phenomenal partners, and certainly President of Stockton, Dr. Harvey Kesselman, came to mind. Atlantic County came to mind. And again, it's just that proof of how it goes here in New Jersey. And in a few short weeks, here we are, just like similar to up north. They've been doing over 1,000 tests a day, so critical to the govs, and certainly Judy's point about those mitigation strategies, all in combination with that social distancing, testing, vaccinations, boosting. A special thanks to Atlantic County Health and certainly Director Kara Jansen. I've just met Dr. Dara Cass for the first time, the HHS Regional Director. And again, it's just about being shoulder to shoulder to make sure this where public health and public safety have converged, that we come together as one to implement these in a time when the surge from Omicron is on. Home testing kits are hard to come by, and to be able to do 1,000 tests here a day is going to mean a lot for South Jersey and certainly the vulnerable communities down here. I think about all the work that our emergency management partners on all levels, local, county, municipal, and it's just, again, another phenomenal indication of our collaboration with HHS, CDC, whether it's hospital expansions, whether it's acute care strike teams. With every challenge that comes up, we put our heads together as a team, regardless of what patch we have on our sleeve or our shirt. I love to see the FEMA Corps crew here at every step of the way. They've been here to support New Jersey and the other 49 states, quite frankly, around the country. So just a complete honor to see this open up here today, and thank you certainly to all of our partners. Gov.
Thank you, Pat, for everything, including those comments. Speaking of our partners, last but not least, please help me welcome the Region 2 Director of the U.S. Department of Health and Human Services, Dr. Dara Cass. Dara?
Thank you, Governor. I'll be brief since I am last, but hopefully not least. I just wanted to commend Stockton University and Atlantic County for identifying a facility that we could come in with FEMA and CDC support, with the governor's help and obviously the Commissioner of Health, making sure that we're here for the citizens of New Jersey to really bring down the cases through this surge. Remembering that testing is what we need in the acute crisis, but vaccinations are critically important in preparing us for the next. So I commend the governor also for his executive order on keeping up-to-date vaccinations for healthcare workers and other people serving in congregate facilities. I think it's really important. And I just want to say thank you to all of our partners, local, state, and federal, to specifically the FEMA team who's here to staff and work with the Stockton University team. This is going to be very meaningful to the citizens of this county who can get tested now in the acute phases. They wait for those rapid tests to come to their houses, as was announced yesterday. So thank you, everybody, for coming today, and I look forward to seeing numbers and numbers of tests come through this site soon.
Thank you, Dara. And I also want to thank the Secretary of Health and Human Services, Javier Becerra, who's been a great partner for us throughout this. As they say in show business, Harvey, this is a wrap. I want to thank Kara and Dara and Judy and Pat, Harvey, Susan, Maureen, the whole team here in Atlantic County, at Stockton, our FEMA partners, state police, others who have made this into a reality. It's a 3-week window, 7 a.m. to 5 p.m. Today's the soft opening, 7 days a week. Come one, come all, get tested. Thank you all so much. It occurs to me for our brothers and sisters in the media, if you all have any questions, we'll be happy to take them.
Hi, Governor. Eric Conklin from the Press of AC.
Hi, Eric.
Question. Wanted to see if you could comment maybe on if you've had some discussions with the White House over the past week, if you've had talks with the President regarding the COVID-19 response, if you could maybe enlighten the public on that. Also, I understand that there might be some problems still with the Vault at-home test. I know that there's supposed to be maybe a few days between when the test is sent to when it would be received. Some folks are reporting that it's taking maybe about a week or longer. I was wondering if you could maybe comment on that, if there's any plans to help with those snags. Also, I was asked to ask you if you could comment on the Atlantic City pilot casino bill and the litigation that's in place with the county. I was wondering if you could maybe update the public on that as well.
Okay, so I'll have Judy observe anything on the Vault front. We talk to the White House all the time. Jeff Zients, who's the COVID czar, and I were exchanging notes yesterday. We have a National Governors Association call, and I'm the vice chair of that organization with the White House, I believe, on Friday to get an Omicron update. But from the president on down, we've been in deep partnership from moment one, in this administration and in the prior administration. No comments on the litigation. We don't comment on litigation, not surprisingly, but I think signing that bill was the absolute right thing to do for Atlantic City, and I'll leave it at that. Judy, anything on the Vault at-home front?
Yeah, a couple things. When we first contracted with Vault, they committed to a 24 to 48 hour turnaround. A couple of weeks into the program, they were impacted by illness among their staff, and the turnaround time increased from 3 to 5 days. I think the longest was 5 days. That has now come down again to the initial 24 to 48 hours. We also had one instance where a specimen from an individual in Virginia was inadvertently labeled incorrectly and ended up in New Jersey. But that's the only supply chain issue that we had heard of, significant supply chain issue that we had heard of.
Thank you.
You're welcome.
Thank you, Judy.
Governor, do you plan on expanding booster requirements to other employees that have vaccine requirements, like teachers or state workers? How is this new expansion of the booster requirement today consistent with your promise that renewing the public health emergency would not be a universal mandate? And last one, are current booster rates not satisfactory if you help
So one at a time. We have no plans at this time to expand this to beyond what we've just discussed today, which is healthcare workers as well as congregant living facilities. It is completely consistent because the word universal implies mandates across the entirety of society, and this is very much specific to these settings because we believe this is where our risks are the highest. And we've tried at every step of the way with Judy's great leadership and Pat. We've tried to meet the moment, not undershoot, not overshoot. We think this is at the right level. I think it's fair to say on your third question, Judy, unless you disagree with me, the booster rates are unacceptable, right? The answer is yes, they're too low. When you're in the high 40s, which is terrific, but when you have about 9 out of 10 New Jerseyans have received at least one dose, and mid to upper 70% are fully vaccinated with their first series, and then you've got a booster rate, what is it, 48? 48%. That's a gap of, depending on how you measure it, 25 to 30 points. It's unacceptable. Thank you. With that, I want to again thank Judy and Pat, Kara, Dara, Harvey, Maureen, Susan, FEMA. Harvey, I'm going to date myself, Bob, Carol, Ted, and Alice. Everybody who's made today possible, get tested. 7 a.m., 5 p.m., right here in Galloway Township. 7 days a week for the next 3 weeks. Get tested. Thank you all. Thank you, Dara. Kara. Thank you, guys.